So the ASPREE study, or aspirin in reducing events in the elderly study, was a clinical trial, meaning that we gave aspirin versus placebo, 100 milligrams or equivalent of about a baby aspirin versus placebo, to 19,000 people in Australia and the US. And here in the US, the study was based here at the Berman Center. And the goal was to see whether aspirin might reduce the risk of dementia, disability, or death. And in the end, after about 5 years of follow-up at the end of 2017, we found that in fact aspirin did not do any of those things. It did not reduce the risk of any of those outcomes, and in fact increased the risk of bleeding by about 40%. Which is not unexpected, as most studies of aspirin have shown an increased risk of bleeding, but more so in our older population. And that it also increased the risk of death due to cancer. That outcome was very much unanticipated because there were previous studies suggesting that aspirin might actually reduce the risk of colon cancer. So the ASPREE study trial ended, but we have continued to follow those patients as participants in the longitudinal observational ASPREE XT study, ongoing now for about 9 years, and we just applied to the National Institute of Aging to continue it for another 5 years. In this country, our goal was to recruit at least half of our participants as either Blacks or Hispanics. And we achieved that by recruiting about 1,250 Blacks and Hispanics in about 30 different sites in the U.S. In the U.S., we recruited about 15% of the overall population of the 19,000. Australia recruited the rest, largely white.